there's a lot of studies looking at fish oil and outcomes in terms of cardiovascular health. Most of them are pretty inconclusive. There's really, there's some very poorly controlled studies where they might find a benefit, but in the highest controlled studies, when we look at the meta-analyses looking at the effects of omega-3s on cardiovascular health, there's really no benefit. But the reason why they are often suggested for heart health comes back to the effect of lowering LDL, right? So we're operating on this prior assumption that lowering LDL must be good for heart health. And then we're operating on the assumption that anything that lowers LDL through whatever means must then be good for heart health. And I think those are two big leaps that we're taking there. And when we zoom in a little bit, kind of blow up that picture and see how the omega-3s are lowering LDL, it's certainly problematic. And there are other things that can lower LDL, like improving our thyroid function or increasing our metabolism, that could have beneficial outcomes and are going to help with cardiovascular health. But I would say that omega-3s are not a good solution there.
And the thyroid, I want to highlight that because the thyroid being the master endocrine gland, that is affecting your heart health, that is affecting your cholesterol. Cholesterol levels can indicate if your thyroid health is off. So all of these things are symptoms and signs to look for if maybe something else is going wrong, instead of taking a medication or a supplement just to lower or increase that one number, correct?
Yeah, that's the issue with having with reducing, the reductionist approach of reducing health issues to a certain marker, right? It's as simple as if we just reduce this marker by any means, we're going to have a better outcome, and we ignore what's actually driving it, and we forget that a marker is just that. It's an indication of a state. It can tell us something about what's going on underneath, but we often, well, maybe not we, but in the especially conventional medical space, don't they forget to actually look at what's going on under the hood, what's causing the state, as opposed to just treating the numbers on the lab work. So I think it's really a missed opportunity there. But then when we do look at, plaque composition, right? What is making up the plaque? It's the damaged fats, the damaged polyunsaturated fats. Both the omega-3s and the omega-6s are really susceptible to oxidative stress. That's going to happen inside the vasculature, and that is, if you're going to see plaque there, that's what it's made up of, and so that's, I think, cause for concern for sure.